All right, you're called a priority red to a construction site for a 31-year-old male. One patient, all hazards have already been removed, seems safe. MOI is a laceration from a worksite trauma. No fry screening completed yet. We will go full contact and drop the PPE.
Okay, so coming on the scene, I'm looking at my patient's tone. They're holding themselves upright. They're tracking me with their eyes. I'm noticing that they are have equal chest rise and fall, and that there's no agonal sounds or strange sounds coming from their breathing. No modeling cyanosis or pallor. Approaching my patient. Hi, my name is Rob. I'm a student paramedic. This is Omar. What's your name?
Chris.
And how old are you, Chris?
25.
Okay, what happened here?
Man, I don't know. I was just working out in this heat, and yeah, one of my coworkers just took some sort of I guess sheet metal, and I guess this is an artery. I'm bleeding bad.
Okay. And are you sick right now, or have you been sick in the last 24 hours?
No, I haven't. No.
Okay, so I'm gonna stick with my PPE. And did you hit your head, neck, or spine?
No, I haven't. No, I just kind of sat down after.
And can you just tell me where you are right now?
Yeah, I'm at Algonquin construction site.
Okay, and why are you here?
I'm just working, man.
Okay. And what year is it?
2025.
Okay, so alert and oriented times 4. I'm going to continue GCS 15. My flow will be DABC. Okay, so noticing any pooling blood around? I'm going to grab my tourniquet. I do notice a little bit of pooling blood. I'm going to put direct digital pressure on the wound. Okay. Good night. One more. Can you take his watch off, please? Get that pen out of his hand. Thank you. You let go of your hand, please. Gonna tighten the windlass 3 times and close it up, putting the time on there accurately. And Omar, you can wrap that up, please. And I'll take that pen light. Thank you. Okay. Do you feel wet anywhere else?
No, I do not.
Okay, I'm just gonna do a little check here. Torso, head, checking my hands every couple inches, checking the arms. Okay, pulse is starting to fade a little bit. You're getting a little cool. And can you feel this?
Barely, man.
Any tingling?
Yeah. A little bit, yeah.
Okay, all right. Can you just open your mouth for me?
Yeah.
Okay. No secretions, blood, teeth, anything like that. No vomitus. Okay, can you just smile for me? No slouching smile. No slurred speech. So I am just noticing equal chest rise and fall, regular rate, rhythm, and full. I'm going to auscultate. Okay, breath for me. Again. Again. This is on bare chest. Again. Okay. Equal chest rise and fall. No adventitious sounds. APCs to bases bilaterally. I'm going to look at his trachea. It is midline. Can you just look to the right for me?
Yeah.
Okay, no JVD present. Just checking for subcutaneous emphysema. None present. I'm going to look at the pulse here. I'm noticing that there is a no pulse on the left hand. There's a pulse on the right, regular rhythm, rate, and strength. I'm checking the carotid as well. Regular rate, rhythm, and strength. Cap refill is brisk. There's none really on this hand, or it's slow. Skin condition is pink, warm, and dry. I'm checking the abdomen for any modeling, which I do not see. I'm checking for any tenderness or rigidity or guarding. It seems to be fine. Assessing the pelvis for stability. And then I'm going to check for peripheral edema on his legs. I'm actually going to remove his boots. Thank you, Omar. No pitting. Seems to be okay. All right, so my patient is CTAS 1, threat to life or limb. He didn't hit his head, neck, or spine, so there's no need for the C-collar at this time. We're going to head to the nearest trauma hospital, lights and sirens. And are you able to walk, Chris?
Yeah, I can. I think.
We're going to get you into this stretcher here.
Yeah.
And just sit up for me when you get in there, okay? Don't lean back just yet.
Yeah.
Omar, you got stability on that stretcher?
Yep.
Okay, perfect.
Just right here?
Yeah, that's good. All right, I'm going to take your shirt off first, okay, Chris?
Yeah, sure.
Omar, you want to help me with this?
Yep.
It's going to be probably hard on his left arm.
Yeah, we'll go easy there. Yeah.
And just sit back, and Omar, you just strap him up, please. That's good there, Chris. Okay, we're heading to the hospital. We're going to say that he's strapped up. I'm going to undo him now while we're in the hospital so I can do my secondary trauma survey. Okay, I'm looking for contusions, color cyanosis, contaminations, lacerations, abrasions, asymmetrical movement, abdominal breathing, sucking wounds, swelling, subcutaneous emphysema, protruding organs, penetrations, or punctures, deformities, distension, dry blood diaphoresis. Checking for tenderness, instability, crepitus, swelling, or deformities in the head. I'm going to look into the eyes here to make sure they're equal and reactive to light. Checking the ears for any CSF or blood. Checking the nose for blood or bruising. Noting the anteriorly to see the trachea's midline. You can turn to the right, please. And you can rub your tongue amongst your teeth and bite down. Do you feel any loose teeth? No? Okay, look to the right, please. No JVD present, lean forward. I'm checking the posteriorly at the C-spine to make sure that there's no step-off deformities, looking for CLAPS-D, feeling for TICS-D, and I'm also doing the same for the thoracic and the lumbar, CLAPS-D, TICS-D, step-off deformities, and mid-spine tenderness. I'm feeling for subcutaneous emphysema, not noting any from clavicles to shoulders. I'm going to get you to breathe in for me. No flailed chest, no fractured ribs, good excursion. I'm going to auscultate. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. I'm looking for CLAPS-D, sucking wounds and deformities, and feeling for TICS-D as well. I'm going to do a sternal check as well for stability, looking at the pelvis to make sure it's stable, looking to make sure there's no modeling in the abdomen. I'm going to palpate the abdomen for tenderness and rigidity, looking for CLAPS-D, feeling for TICS-D. Looking at the abdomen, I'm going to palpate the bladder, noting any priapism, checking for CLAPS-D, feeling for TICS-D. And I'm also going to note any priapism and say, is there any like wetness or pain down there? Okay, it's not going to expose the genitalia. Checking, looking for CLAPS-D, feeling for TICS-D on the legs. Checking the dorsal medius pulse. No shortening or rotation to the legs. Can you feel this?
Yeah.
Can you wiggle your toes? Perfect. Going to do the same on the arms, CLAPS-D and TICS-D. And do the same on both arms. Check the pulse. Can you move your hands for me, please? You feel this?
Yeah.
Yeah? Okay. And I'm looking for a medical alert bracelet and rotation or shortening.